Welcome back to Living Dayton, everyone. We are in the doctor's office, as you can imagine right now. This is getting intense. Getting your heart checked regularly is vital to your health as we progress in age, and America's fitness doctor, Dr. Rob, is going to tell you about a 20-second heart test that you can do, and he's also going to show us how it works. Dr. Rob, I feel like I'm the patient.
You
right
are.
Now. Okay.
Today, you get to be a patient,
okay,
which is a fantastic thing because people go to their doctor on a regular basis to get their wellness exams.
Right.
And part of that wellness exam is screening for cardiovascular disease, screening for heart disease, because people don't want to have heart attacks and strokes.
No.
And so they go to their doctor to get that examination. Well, it turns out that the traditional risk factors that we screen for, do people smoke? What's their age, their gender? Are they overweight?
Right.
Isn't a good predictor of whether you're going to have a heart attack or stroke. And as it turns out, 77% of the people that have a heart attack have normal risk factors by traditional methodology. So what are we going to do? That's a problem. I mean, if 77% of the people have normal risk factors, but they're having heart attacks or strokes,
sure,
what's the solution?
Right.
And that solution is carotid ultrasound. And that's the piece of equipment that we brought in today.
And this is the lovely model D that's going to help you out a little bit.
D is our lovely ultrasonographer, and she's actually going to take a real close look at your neck.
Okay.
And in a very quick 20 seconds, we're going to be able to tell if you have disease in your carotid artery. And if you have disease in your carotid artery, you have disease in your heart. And so that we can change the treatment, we can monitor treatment by using this machine. So this carotid ultrasound machine takes the wellness exam to the next level. It makes it that much more effective at predicting disease, monitoring disease, and treating it.
This is important. All right,
this is important stuff.
We've got 3 minutes left.
So all you need to do is lay down.
Okay, go ahead and start doing that. Okay. Oh, this, I'm nervous.
Oh, you don't need to be nervous.
Okay. D, take care of me now.
And so what we're doing now is we're setting Sean up, and we're going to take a real close look at his carotid artery. And this machine does a wonderful job at doing that. So we're going to take a look at the right artery here first. Here's your transducer. And Brandy, can you see the monitor here? Okay, great. So we're going to have you turn your head this way just a little bit, Sean. And in a real quick sweep, Dee's going to show us your carotid artery. And we're going to see it right here on this screen.
Now, I had a lot of spaghetti last night.
Did you? Can you compress down for me?
Mm-hmm.
Okay, great. Come back over this way a little bit. Good. And so here's Sean's carotid artery right here. I'm going to go ahead and freeze that. And so what we're looking at right now, and I don't know if you can see that on the monitor, is Sean's carotid artery. And inside that artery, what we're looking for is plaque buildup. And if he has evidence of plaque buildup, then we know we need to alter his therapy or his treatment. So within 20 seconds, we're able to tell if he has disease in his carotid artery or not. Since there's no disease in his artery, we know most likely his arteries in his heart are clear.
Yay!
And I know that you have a strong family history of heart disease.
Yes.
Let's take a look at the other side. And so what Dee is doing here is putting a little ultrasound gel on the transducer, and we're going to have you turn your head here. And then we're going to take a look at your other artery, and in 20 seconds we'll have an idea if it's clear or not.
But the first one was pretty good, right?
Oh, it was absolutely clear.
Oh, good.
There we go. And here we go. I'm going to move this back this way. And you can see Sean's carotid artery right here. And when there's plaque in it, actually something protrudes out into the artery itself. And his arteries are clear. So we can give you a clean exam today on your carotid arteries.
Thank you, Dr. Rob.
Isn't that fantastic?
This is fantastic. I wish I could get a round of applause from the studio. They don't
yeah,
care.
we can get your
Oh, there they are, and they're still there.
So this in-office ultrasound machine made by Panasonic allows us to take a direct look at your carotid arteries, which is allowing us to really look at your heart and let us know what's going on with the arteries in your heart.
So I do have a heart.
Yes, you do. You have a very strong heart.
Thank you.
But then I feel more comfortable as a physician being able to say, you know what, Sean, you don't have any evidence of disease. And that is a really valuable wellness exam.
If
tool.
someone out there wanted to get this done, where could they find you at?
Well, we use this ultrasound machine at the Alpha Male Medical Institute, which is located in Springboro, Ohio. And it's part of our wellness exam along with several other diagnostic tests like a DEXA scan for bone health and carotid ultrasound, which we just performed on you, and VO2 max testing. We test the strength of your heart.
Right.
And then we also do tests to screen you for dementia. So we put you through neurocognitive testing, all part of an extensive wellness exam.
And alphamaleinstitute.com if you want to check out a little more. America's Fittest Doctor, Dr. Rob. N.D., thanks so much for having me and checking me out and give me a clean bill of heart health. We appreciate it.